Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official. Today we will discuss one important topic from infectious diseases, that is leprosy or Hansen's disease. Leprosy or Hansen's disease is a chronic, non-fatal infectious disease and it affects mainly the cooler parts of the body, that are skin, mouth, respiratory tract, eyes, peripheral nerves, superficial lymph nodes, and testes. Earliest and main involvement will be skin and nerves. Remember this important point. Leprosy, earliest and main involvement will be skin and nerves. Causative organism is Mycobacterium leprae and it closely resembles Mycobacterium tuberculosis, but it is less acid fast. Leprosy appears in tissues as compact round masses, also called as globi, or parallel fashion-like cigarettes in a pack. Demonstrated in the tissue sections, split skin smears, scrapings from the cut edges of the dermis, and nasal smears using acid-fast staining, Gill-Nielsen staining, white Ferraco staining, GMS staining, or Gomori methanamine silver staining, and polymerized chain reactions. Mode of transmission. It is a slow communicable disease, and the incubation period for leprosy between first exposure and appearance of signs and symptoms will be 2 to 20 years. Average is 3 years. Direct contact with untreated leprosy patients, maternal-fetal transmission across the placenta, and transmission from milk of leprosy affected mothers to infant is the mode of transmission. Coming to the immunology of the leprosy, it is hypersensitivity reaction type 4, delayed hypersensitivity reaction, and that too T cell mediated delayed hypersensitivity reaction. Lepromin test is not a diagnostic test, but it is used to classify the leprosy on the basis of the immune response. Intradermal injection of lepromin, an antigenic extract of Mycobacterium leprae, will reveal the delayed hypersensitivity reaction in patients of tuberculoid leprosy. The early positive reaction appearing as indurated area in 24 to 48 hours is called as Fernandez reaction, and the delayed granulomatous lesion appearing after 3 to 4 weeks is Mitsuda reaction. Early reaction is Fernandez reaction and delayed reaction is Mitsuda reaction. Lepromatous leprosy is negative for lepromin test, and this test indicates cell-mediated immunity. Greatly suppressed in lepromatous and good immune response in tuberculoid tuberculoid leprosy. Remember, I for immune response and in tuberculoid there is a alphabet I. So there is good immune response in tuberculoid leprosy. Coming to the classification, Ridley and Joplin's classification of leprosy has been followed. Lepromatous Lepromatous leprosy type is showing low resistance and tuberculoid leprosy type will have high resistance. Two opposite poles of host immune response, so-called polar forms of leprosy. So in the Viva, they may ask you what are the polar forms of leprosy, then you have to answer it as lepromatous leprosy and tuberculoid leprosy. And the classification name is Ridley's and Joplin's classification for leprosy. Based on the clinical, histological, and immunological features, there is a modified Ridley-Joplin classification where these two polar forms are subclassified and made into five types. One is tuberculoid TT, tuberculoid polar, borderline tuberculoid, mid borderline, borderline lepromatous, and lepromatous polar. Tuberculoid polar will have high resistance and lepromatous polar will have low resistance. So remember T for top, high resistance. Lepromatous leprosy, L, low resistance. Variants of leprosy. Indeterminate leprosy. It is an initial non-specific stage of any type of leprosy, and pure neural leprosy. The name itself is saying there is neurological involvement and it is the characteristic of this leprosy. The cardinal feature will be there will be no skin lesions. Histoid leprosy, it is a variant of lepromatous leprosy. The skin lesions will resemble the nodules of a dermatofibroma, and lesions are highly positive for the lepra cells or leprobacilli. Reactions based on the shift in immune status or in patients of leprosy on treatment, two types of reactions will be there. Type 1 reaction and type 2 reaction. Type 1 reaction is called as reversal reaction and type 2 reaction is called as erythema nodosum leprosum or ENL. Coming to type 1 reversal reactions, these are borderline groups are unstable and may move across the spectrum in either direction with upgrading or downgrading of the patient immune status. Coming to type 2 reactions, erythema nodosum leprosum, it occurs in lepromatous patients after treatment. Histopathology of leprosy. We have to look for the general features, cell type of granuloma, the nerve involved, bacterial load, presence and absence of lymphocytes, and relations of the granuloma with epidermis and adnexia. So, five features. One is cell type of granuloma, whether nerve is involved or not, bacterial load, and presence or absence of the lymphocytes, and relation of the granuloma with epidermis and adnexia. In lepromatous leprosy, there will be proliferation of foamy macrophages around the blood vessels, nerves, dermal appendages in the dermis. And these foamy macrophages are called as lepra cells or Virchow cells. Lepra cells can be asked for 3 marks question. Lepra cells are heavily laden with acid-fast bacilli and they are arranged in globi or cigarettes in a pack fashion. Dermal infiltrate of the lepra cells separated from the epidermis by subepidermal uninvolved clear zone. So, clear zone is present in lepromatous leprosy. This can be asked for MCQ. Epidermis overlying lesions is thinned out, flat, and may even ulcerate. So, this is a beautiful picture showing the lepromatous leprosy. If you observe, there are collections of macrophages, foamy macrophages, which are called as lepra cells or Virchow cells in the dermis, and there is a sparse lymphocytes, that is, there are no lymphocytes, and there is a clear subepidermal zone separating the regions. So, clear zone is present. Coming to tuberculoid leprosy, the dermal lesions showing the granulomas resemble hard tubercles, and they are composed of epithelioid cells, Langhans type of giant cells, and lymphocytes. Dermal nerves mostly affected and they are destroyed and infiltrated by the epithelioid cells and lymphocytes. Granulomatous infiltrate will erode the basal layer of epidermis. So there will be no clear zone. Clear zone is absent in tuberculoid leprosy. Lepra bacilli are few and seen in destroyed nerves. So this is a beautiful picture shown for tuberculoid leprosy. If you observe this, there will be granulomas eroding the basal layer of the epidermis, and these granulomas are made up of epithelioid cells and Langhans cells and many lymphocytes. So lymphocytes are present in tuberculoid leprosy. Eroded epidermis is present in tuberculoid leprosy. Langhans type of giant cells are seen in lepromatous leprosy, tuberculoid leprosy. Answer is tuberculoid leprosy. Eroded epidermis is seen in tuberculoid type of leprosy. Pure neural leprosy, histopathological features can be seen in a nerve biopsy specimens and they may be AFB positive or negative. And remember the point, skin lesions are absent in pure neural leprosy. Histoid leprosy, whorls and fascicles of spindle cells in the upper dermis after clear subepidermal space, and the foamy cytoplasm will be laden with lepra bacilli. Type 1 reversal reactions can be upgrading or downgrading. Upgrading means there will be increase in the lymphocytes, edema of the lesions, necrosis in the center. Downgrading of the lesions means dispersal and spread of granulomas and increased presence of lepra bacilli. Type 2 erythema nodosum leprosum, infiltration of neutrophils, eosinophils, and prominent vasculitis. The inflammation exceeds deep into the subcutaneous fat, causing paniculitis, and the bacillary load will be increased. Clinical features, in lepromatous leprosy, the skin lesions will be symmetrical, multiple, slightly hypopigmented, and erythematous macules, papules, nodules, or diffuse infiltrates can be seen. Nodular lesions may combine to form leonine phases. Lesions, hypoesthetic or anesthetic, but sensory disturbance is not as distinct as in tuberculoid type of leprosy. So remember, in the lepromatous tuberculoid leprosis, lepromatous will have M alphabet, multiple, L for leonine phases, S for symmetrical. Tuberculoid leprosy, skin lesions will be asymmetrical if multiple, or single, they are hypopigmented and erythematous macules. Here distinct sensory impairment is present. In the alphabet, D stands for distinct sensory impairment, which is present in tuberculoid and absent in lepromatous leprosy. So these differences between lepromatous leprosy and tuberculoid leprosy can be asked for 6 marks questions and sometimes 3 marks question. They may even ask you to draw a neat label diagram of lepromatous leprosy or tuberculoid leprosy. So let's discuss this. Lepromatous leprosy and tuberculoid leprosy can be differentiated based on the 6 features. First one is skin lesions. In lepromatous leprosy, they are symmetrical and multiple, whereas in tuberculoid leprosy, they may be asymmetrical, single, or few lesions. In both lepromatous leprosy and tuberculoid leprosy, both are hypopigmented. Sometimes papillary or nodular lesions may be seen in lepromatous leprosy. These nodular lesions will fuse to form leonine phases in lepromatous leprosy. So, leonine phases is seen in lepromatous leprosy. Nerve involvement is present in both lepromatous leprosy and tuberculoid leprosy, but sensory disturbance is distinct in tuberculoid leprosy. Coming to histopathology, there will be foamy macrophages collection, which are called as leprocells or vercocells, that are present in the dermis and separated from the epidermis by a clear zone. Whereas in tuberculoid leprosy, there will be hard tubercles similar to the granulomatous lesions, consisting of epithelioid cells, Langhans type of germ cells, and few lymphocytes eroding the basal layer of the epidermis. So there is no clear zone in tuberculoid leprosy. Bacteriology, lepra cells are highly positive for lepra bacilli, seen as globi or cigarettes in pack appearance, multibacillary type. Lepra bacilli are few and seen in destroyed nerves as granular or beaded forms, called as paucibacillary type tuberculous leprosy. Immunity is suppressed and low resistance in lepromatous leprosy. Immune response is good in tuberculoid leprosy, so high resistance. Coming to lepromin test, it is negative in lepromatous leprosy, whereas it is positive in tuberculoid leprosy. So, in a nutshell, remember lepromatous. S indicates symmetrical, M indicates multiple, L indicates leonine phases, L lepra cells, and there is low resistance. L for low resistance in lepromatous leprosy. Coming to the tuberculoid leprosy, D stands for distinct sensory disturbance. Tuber, heart tubercle is present. There is no clear zone in tuberculoid leprosy. Tuberculoid leprosy is paucibacillary type and it is positive for lepromin test. Thank you for patient listening. Please like, share and subscribe Dr. Ravichandra official for more interesting pathology videos.